She is a physician. She has written all over the place, including a New York Times op-ed, and she was a Bernie Sanders surrogate. And
cool.
her name is Dr. Dooley. Hello.
Dr. Dooley. Doctor in the house.
I'm great.
Yes. Thank you so much for joining us. I haven't seen, so the doctor and I, we actually met up in New York at Bernie's comeback rally in Queens. Back. That was amazing. Yeah, Bernie's back. Yeah.
Man, what a wonderful moment, right?
Yeah, that was so magical.
It was so amazing.
Like 100 years ago.
Yeah. But welcome to the show, and this is my Wednesday night co-host, Nando Villa, and everyone's very excited to be talking to you.
How are you?
And I wanted to have you on for so many reasons. I've had you on my podcast before, and there's this big debate now because Biden is, Biden's going to Biden, and he's already said that he would, if Medicare for All passed his desk, he would veto it. And there's so many myths out there, and people say it's a great idea. It just, right-wingers say it's a terrible idea. It's socialism. It's socialized medicine. I just remembered, did Biden say socialized medicine, or is that just Trump?
I don't know if Biden said it.
Yeah, maybe not. But fine line. But
Biden made that point that in Italy, it didn't help them with the coronavirus.
Right. That was
Remember that? When Italy was like the original kind of hotspot. It's like, well, they got socialized medicine and it didn't help them. It's like,
yeah. So, well
what
said.
A cynical point.
Yeah. Well, but, yeah. I was just going to ask you, what is your response to all the people who have the more either ignorant or disingenuous, maybe, depending on who we're talking about, argument that it's a great idea, it just can't happen?
Well, Katie, the frustrating thing is that all of our politicians know, they're intelligent people. They know Medicare for All makes sense. They know it saves money. There's been study after study that proves that it saves money. University of California, they reviewed 22 studies. They all show that a single payer Medicare for All system saves money, whereas Medicare for All who wants it does not. So these are facts that can't be disputed. And so when we have elected these officials who are not fighting for what's in our best interest, it makes my stomach hurt. It's disgusting. It's gross. If you just think about it, a for-profit model is going to raise costs. I mean, this is not something that you have to have, a rocket science,
an MBA,
right, to understand. A for-profit model is going to cost more. And when you look at things like the administrative costs and billing costs, most of what insurance waste is at administration and billing. So moving to a single payer system is going to save something like $400 to $600 billion just in administrative costs alone. When you talk about medical billing, every person's going to have this different insurance, right? And so insurance billing is so complicated. Why? Because they don't want to pay you. So we as providers, we have to play this game and put the right numbers in the right boxes and, dot this I properly and slash this T properly in order to get it paid, because ultimately they don't want to pay you. So it's so complicated, and each individual insurance company is going to have this different set of rules about how do you have to bill them to get your money. And it's so complicated that health systems and hospitals, they have to hire one person that's the expert in each individual plan, because it's so much knowledge that you have to have, and it's so different from plan to plan that you got to get one person that all they study is health insurance company ABC, because the rules are going to be so vastly different between company per company. So that is where we have this huge amount of waste. And a system like Medicare for All who wants it, any system that keeps private payers in the mix, is not going to do anything to solve this problem.
I laugh every time you say Medicare for All who wants it, because that was Pete Buttigieg's brilliant plan. Who Biden, for all his flaws, I don't sense him to be like a fully cynical person, whereas Pete Buttigieg is, to me, like pure cynicism, because he knows better. And I just took the great pleasure.
Yeah, Biden knows better too. Biden knows better. He's just not as.
But Biden is more. Biden doesn't think as much. He's not that smart.
Biden knows better. He's not quite the devious Rhodes Scholar that we know.
And they're going to send him off to China, which is like the funniest thing ever. He's going to get the ambassadorship to China.
I know.
That's what he gets for dropping out early. Yeah, that's great.
But the thing is, when people who don't support Medicare for All, when they're not politicians, and I'm talking to them and I explained it to them, I'm like, okay, well, why do you think it can't happen? Well, I think it's going to cost too much money. And then I explain, here's a study that shows how it's going to cost less. And I explain the whole billing system and how if we eliminate that, we're saving a lot of money. Then they get it and they say, oh yeah, that's a great idea. But politicians, they have the same information available to them and they pretend that they don't get it. And that's the frustrating thing, because the vast majority of people do support Medicare for All. And when you explain it right, it's virtually almost everyone. And it's intentional. When we talk about Medicare for All, we're talking about improved Medicare. With Medicare Now, you have this 20% cost sharing. Okay, with Medicare Now, it doesn't cover dental and vision. But the Medicare for All and Senator Sanders and Jayapal's bills, they include dental, vision, long-term care, hearing aids. They eliminate that 20% cost sharing. And that is something that is never talked about in the media. So it's understanding to me why every time I post about Medicare for All, somebody's like, well, hey, Medicare is not that great. The 20% is killing me. But nobody in the mainstream media wants to talk about how a Medicare for All system is going to eliminate all cost sharing. Not only that, it's going to save us money. So it's so frustrating that so many people don't have this basic knowledge. And if they can get it, I think we could get closer to like 95% of people supporting Medicare for All.
Yeah, imagine if there weren't an entire like corporate advertising, media, political, industrial complex telling people why this is so awful. Imagine how popular it would be. I mean, it already is popular, right? When it's
remarkable that it's remarkable that it is as popular as it is, given all that you mentioned, like the entire, like basically every single person in the media being against it, and yet it's still, because it just seems so obvious to people. I mean, Chomsky used to always say this is like an old Chomsky line. He used to always say that people, when you ask people if they think like the government should guarantee healthcare is in the Constitution, something like 90% of people say yes, because it just seems so obvious to them that the government should guarantee everyone's healthcare, that they assume it's in the Constitution, even though it's not. So yeah, it's just intuitively people believe that it's something that should be not left up to the ravages of for-profit markets.
It should. Yeah. Certain things should be for profit.